How do you get smooth, glowing skin? That was the question, and in the more info below, you can record your question. There's a link, and I'll play it back and answer your question on this channel and on my Instagram. So glowing, smooth skin. Let's deal with the smooth first, because in order to have glow, you need to have an even surface. So if you take a surface that's going to reflect back, or like the TV back here is reflecting the lights, that's because it's a smooth surface. The smoother that TV is, the better the reflection. Same on the face. You see the light that's reflected back. The things that stop the light flow or the reflection are going to be irregularities and discoloration. So those are the two most important things for clear, glowing, smooth skin. I'm going to go through some skincare, some devices, and an injection. We usually do those because some people want non-injectable, minimally invasive, and skincare can work wonderfully here. My number one choice for skincare, of course, is an AHA-BHA combination cream. Glycolic acid is the smallest form of alpha hydroxy acid we can get, and glycolic acid is the jack of all trades. It helps with fine lines, it helps exfoliate, it helps with discoloration, it helps rejuvenate the skin and thicken the dermis. So it's an easy option. It is well tolerated. Now, if you're going to go this route, I recommend for most people a cream that you're going to use 2 to 4 times per week, and it will be a combination glycolic cream. That would be most accessible to people. You're going to feel a tingling probably for the first week or two, because most creams are going to be about 10% glycolic and have combinations of other products in there that might be a little bit more aggressive. In mine, I go for a 10% and I add a beta hydroxy because that helps with blemishes and fine lines as well. And it's oil soluble, so it helps with pores, because pores can stop the light reflection. So the first product I would recommend would be that, an alpha hydroxy acid. Most will be combined with a beta hydroxy. Even if you're going the chemical peel route, which is the next step, not quite a skin cream, but if you're stepping up your game, you can do intermittent chemical peels with glycolics, and those for most home gamers are going to be around 10 to 30%. As you get up to 70%, it's a little too intense. The side effects increase, and you can get post-inflammatory hyperpigmentation, poor healing, and problems therein. So I recommend the cream form in the combination. Now, my second runner-up to that for glowing skin, particularly to get smooth skin, would be a retinoic acid. Now, you got retinols, which convert to retinoic acid, the most powerful form, in a 2-step process. I like the best retinaldehydes because that is a 1-step conversion to your maximum product or maximum strength product, which is your retinoic. So retinaldehyde hits the sweet spot for most people. Sensitive skin people go more towards the retinols that are so readily available. Use them a few times a week. Now of note, you'll find chemical peel combinations that do have retinoics along with glycolics in them. They do exist, so for the home gamers using peels, a combination peel is often good. Keep in mind a glycolic is one of the treatments for keratosis pilaris, and that is those irregular bumps people get not only in the face but the body because the glycolic exfoliates. So that smooth skin is all important, and a glycolic is certainly a good choice with or without a retinoic. So that's your skin cream combination, along with an option for a chemical peel. My next choice after the glycolic for a peel would be mandelic acid, which would be less irritating than your glycolic. So another peel option for you. My second option, and this would be also something home gamers can do, which is microneedling, which is the derma roller or the Anti-Age Growth Factor Derma Roller Kit. Now, this is something you can do at home. The growth factors are absorbed better because the Derma Roller is a 0.25 millimeter derma rolling pen. And growth factors work excellent and they help smooth the skin, they help build collagen, they help make the skin robust, and that along with the derma rolling can smooth the skin. It can even help with some smaller acne scars. And the next question people would ask, well, what if I go beyond 0.25 millimeters and I go more towards what some of the pens or even some of the rollers go 1 to 2 millimeters? And yes, I do like that. As you go deeper, I would go from a derma roller to a derma pen, because now you're talking collagen induction therapy. So you're going to that next step of collagen growth, and the derma roller, as you go beyond 1 millimeter, creates more of a V-like opening because you're rolling it over the skin versus the pen going straight up and down. So that would be a consideration, and that is, again, something you can do at home. Now, option 3 would be in a clinic, and there's 2 main options to smooth the skin. High frequency ultrasound or high intensity focused ultrasound or micro focus ultrasound, which is Ulthera. Those aren't going to smooth the skin or the skin surface. Think of those as skin tighteners. But RF microneedling, and better yet, fractionated RF in devices that don't actually have needles that go into the skin are best for most. And this is an example here I'm showing you of using that device. You can use it on the face and the neck and of course the body, but what it does, it remodels the skin. There's deep heating and superficial heating, so you can get some pigment. It's not the best for pigment, but it's the best for remodeling. So what we're doing is denaturing the proteins, we're disrupting that dermal layer, and as it grows down, we want the collagen fibers to stack smoothly as opposed to irregularly. And when they're irregular, that forms, some people call it a scar tissue, but irregularities in the skin. So you want to have the right amount of heat to stack the collagen fibers so they're smooth. And by having an adjustable system like this, you can smooth it. It feels exfoliating for the next 4 to 5 days. And the next step of this is, while the patient's healing, hit them with the growth factor skincare. Immediately, within an hour after, we use growth factor skincare to get absorption, and the combination of growth factors and remodeling is just beautiful skin that's glowing and smooth. Think about 2 or 3 treatments, especially if you have acne scarring. Finally, an injectable. Acne scarring, people use Bellafill or permanent injectable products for rolling type acne scars, can work well. But if you want to go new school, think growth factor, stem cells, simple blood draw, spin it down, inject it back as a liquid or as a more firmer gel. And it is amazing. The growth factors, particularly vascular endothelial growth factor, VEGF, you'll see it all over the place in growth factor skincare products, but it's also just in your own blood. There it is, spin it down. And you have other growth factors like collagen growth factor, remodeling growth factors. But when you inject it, even for vertical lip lines, it's very amazing how smooth the skin becomes and how much we do not have to then resurface with a device. Pretty amazing how an injection from within will help the surface of the skin. That just goes to show what growth factors and cytokines and all your healing factors from your own body concentrated and put back the power of what they do. This is the future of medicine. It's less fillers, less synthetic biostimulators, and much more your own body's products. So skin that's glowing, that's smooth, then finally needs to be finished. You need a finishing product to plump it, to help bring moisture in, and to take all those little fine lines away. Nothing better than an antioxidant plumping soothing cream with organic oils. An example, if you're on one in the comments, share with other people. In my line, that would be my Ultra Moisture, which has organic neem seed oil. It has organic sunflower seed oil, organic grape seed oil, and a host of other organic oils that help go in as an antioxidant, plump the skin. I love oils on the skin, so think about that. We started with acids on the skin, more aggressive. We finish with oils on the skin, and that gives that perfect light reflective surface. And of course, you're looking for things with no fragrances. You're looking for things with, a lot of people don't like parabens. I personally don't have a big problem with parabens, but we just keep all our skincare paraben free and alcohol-free, fragrance-free, because there's no need for it if there is some controversy. But you need that finishing touch at the end. You do not want inflammation on your skin, and that group of oils or a similar product thereof, love to hear what you're using and what you like, is key to finish and get that beautiful looking skin. Stay tuned here and certainly ask your question. Go right now to the more info section, click on that Ask Dr. Rajani, record a question, give it to me. I'll play it back on my social media and we'll answer it for you. Yes, you'll hear your voice on my social media platforms. Hopefully you'll enjoy it. Stay tuned, keep your skin and body beautiful, healthy, and vibrant.